So she does okay with dissociating with client when they start to dissociate and doesn't resort to grounding. But when a panic key part comes in, it's very hard for you to stay and you get triggered and you start to do the grounding. Is that accurate? Yeah, so...
It gets so like agitated and panicked and...
Right.
Get me out of here.
Right. So it's a really important comment because on several levels. First, I talked about the 8 C's, but we also have what I call the 5 P's in IFS, which are qualities of the therapist in addition to the 8 C's. Guesses about the 5 P's? Patience.
Playfulness.
What?
Playfulness.
Playfulness? People don't usually guess that one. That is one. Presence.
Passion.
Okay, you guys know it. You're cheating. And the one you didn't mention is perspective, which is really the IFS perspective. So what you're getting, I hope by now, is this is a very different paradigm for understanding trauma and all these other things. And one of the big differences is dissociation, flashbacks, panic attacks. What else with trauma? Resistance, flooding, numbing, dissociation are not pathological psychological processes. They're the activity of protective parts. It's a huge shift in understanding of these things. If you think of them as pathological psychological processes, you've got to do something to control them. If you think of them as the activity of protective parts, you go to the part, you get to know it, you honor it for what it's trying to do, and you negotiate it, separate it. Huge difference. So the minute you do grounding skills with somebody who's got a panic attack, you're telling this terrified little girl, get out of here. You don't belong here. So if somebody's having a panic attack, I'll say, it's great you're here, just like I did here. It's really good. You're really welcome here. I get you're stuck in a really scary place. We're going to get you out of there. It'll be a little easier to get you out of there if you'd separate a little bit so she can be with you and not be so blended with you. Would you be willing to pull your energy out of her a little bit? And boom, she's grounded. That's a totally different message to the part. You following this? Yeah. So this, you got me on my soapbox. This is my crusade to the trauma field. Yeah.
So sometimes working with very young parts that have gone through abuse and they're coming out of profound dissociation, and we clean them up and dress them and untie them. And what happens is then the image patients or clients will say will degrade, and they'll go home and they'll look again and the rope's back on and the bloody underwear's back on.
Really good question. So there are times when burdens come back. And I used to get very discouraged and think, oh, this doesn't really work. And then I got curious and asked around, why are they coming back? Turns out there are 4 common reasons. So we find out which of those it is, we fix that, now they don't come back. So you want to know what they are? Yeah. So the most common reason they come back probably is that you didn't get the whole story in the witnessing. There's more the part needs to show you, so she went back in, so you'd be forced to see the rest. Second most common is client didn't follow up during the week. So the part felt good in the session, was in a nice place when we left, but then felt abandoned by the self and went back to what was familiar. Third, the unburdening of this part scared other protectors who relied on this burden to control the client. So just a quick example. Let's say it was the burden of worthlessness, and we shipped it out, and now this little girl feels great, like here, but there was some controlling protector that would poke the worthlessness to keep her from doing something it thought was dangerous, and now it can't control her. And so it sent it back. Does that make sense? Yep. And the fourth You know Derek? There's something during the week after the session, scary, that happens, and the parts assume it's because you did this unburdening and are superstitious about it, and they kind of throw her back. So it's generally one of those four. Then you find out which it is, you fix that one, and then the burden sticks, unburdening sticks. Yeah. Yeah.
Is this what you would say why backlash happens?
Backlash happens, that third one is part of the backlash. But backlash in general happens when you don't respect the protector's pace and you go too fast to exiles. And if you're going to work with serious trauma, you've got to have a fairly high threshold for some degree of backlash. Because I've done it where I did everything right. I up front asked all the protectors I could find if it was okay. I got permission from all of them, and still there was backlash. Then I went to the party. I said, I thought you gave me permission. Yeah, but I couldn't help myself. You know, was the kind of reaction. So, so then you go to the part, the backlash. You get to know it. You say, okay, I get it. It's terrifying, and so on. Then you work with it. It becomes the target part, and you help it heal. The important thing to remember is all this stuff is the activity of parts. So too many, I mean, this is my big crusade with EMDR, with all kinds of systems, because you can bypass protectors by doing this and go too quickly to exile. And then clients have backlash reactions, and the therapist thinks, oh, she's sicker than I thought. This is more scary than I thought. Let's bring in the medication, let's bring in the hospitals. And you get this vicious downward spiral that way. And I picked up the pieces from many such clients. So this is my appeal to the trauma field. Just respect the pace of the protectors. Many people are combining IFS and EMDR now. Before they do any of this, ask if there's any parts that don't want to go there. And just get permission, and then do this. And it works fine.
So I noticed that you say a lot, just stay with it. Just stay with her. So what's that about? Because
I'm telling, mainly I'm speaking to the protectors. I'm saying this is okay to stay with. I'm telling self to stay with the exile. And just stay with the feelings, and just let them come, and just stay with those feelings. It's okay. Just constantly saying, this is okay, this is good. Yeah. But mainly I'm speaking to the protectors who, you know, they're in a waiting room, but they're just dying to jump out and take over. So, yeah.
I was a little confused about the age and the time, because earlier what I heard was that you were helping her to know that she's 40, but then it seemed like you were also giving the 18-year-old permission to be 18 or to feel 18. I'm wondering if you can talk about the time orienting of the parts.
Well, from my point of view, it's real. It's an 18-year-old little girl, not little girl, 18-year-old girl in there who shouldn't have to be responsible, shouldn't have to be running things, but has been running things, has been one of these parentified children. And so I'm not sure your question, so I'm just saying.
Okay, so the self, you see the self as being the age of the biological person, but the parts
Are whatever age they are, yeah.
whatever age they are. And
Yeah.
they don't change. Like, well,
Sometimes they change, but sometimes they get younger when they unburden. Sometimes they get older, but they'll go to the age for which they're designed, is my take, when they unburden. And they don't grow, they don't usually get older than that. Yeah.
Okay.
How do we medicate people without giving the message that they need this extra protection? Is that basically the question?
Yeah, or that the protector's not welcome.
Because we're trying to medicate the protector out of business, yeah. And so much of medicine is designed to kill the messenger rather than to listen to the message. So, so what Frank will say, because there are medications, especially when you're really blended with a lot of scary parts, that just create a little separation, you know, that just help with the unblending so the client can actually work with the part rather than be the part. And So those are actually helpful medications, temporary, as long as it's seen as temporary. But the same medication with a different client will kind of shut everything down, so it's very hard to interact with anybody inside. So Frank will try a medication and then just say, ask your parts if this is getting in the way or if this is helping in communication in there. And based on the feedback from the parts, he'll adjust the medication dosage or he'll try a different medication. So it becomes a kind of collaboration with the parts of the client. And they can pretty accurately tell you if it's getting in the way or not. And also, another thing he'll do is, there are parts, for example, in trauma survivors that don't want you to sleep. You give them sleep medication, and they're going to override that, or they're going to try their best, or they're going to feel like you don't get it. And they're going to be angry at the psychiatrist, they'll be angry at the client for overriding them. So before he'll go to give sleep medication, he'll just say, is there anybody in there who really doesn't want this to work? And he'll do the work up front and get permission, and then the medication works.
Hello. So I was just going to say that part of the deal with trauma is the rage, and just to watch that powerful demonstration of rage moving through her. And it sounds as if her husband is getting a fair bit of that rage,
Right.
and he takes it on, and it's
Right.
very wounding to him. But if he can just see that it's a response to really a terrible thing, that he doesn't need to get sucked into it.
That's
And-
right. That's really true. And also she's going to have less rage. Great. She's going to have less rage once this little girl is healed.
Better.
Better? Oh, much better? Oh, okay. All right. And we can unload the rage. But in the meantime, it does help him with perspective on it, and it's not about him, and so on. So this is a big couples intervention, to have one partner do the work while the other partner witnesses it. Now, you need to be sure that the witnessing partner is going to be able to stay in self, because you don't want her to come out and feel any kind of judgment or any kind of fear or anything, or, yeah,
There was the clouds, the words in the clouds,
yeah,
the black smoke, I mean.
yeah,
And at one point she says, it's your fault, or it's my fault. I didn't
it's my fault.
And I could tell that you were a little bit like disturbed, but I would be disturbed by that.
Oh, there was a point where parts came in to say that it was her fault. Right? The burden, there was the burden of it's my fault and I'm alone and what else? Ugly, contempt. Somebody took good notes, yeah. So those were all burdens coming out of her in the smoke. And then there were other times where parts came in and tried to blame her, and I got them back into the waiting room right away. I didn't spend any time with them. Is that what you're asking about? Yeah. So as you can see, I'm kind of a hard ass with these protectors. When we're focused on an exile, I get very protective of the exile. And I don't want any of these guys coming in and shitting on it. And I also know that once we heal the exile and we bring them all in, they're going to change. They're going to see her very differently, and they're going to relax, and they're not going to be doing those bad things. So it behooves me to just get them out as best I can until we're done, and then everybody relaxes. So that's my style, is to not spend a huge amount of time schmoozing with protectors if I can avoid it. Because you're mainly getting them in their extreme state, and they'll run you around and around with their stuff. But if you can just heal what they're protecting, then they're very different afterwards. Yeah.
I'm just amazed that they listen, like you
Yeah.
say, back in the waiting room.
Yeah.
That's pretty direct.
Very direct. And you got to be comfortable with that. And they listen, and sometimes they don't. So this is one of those videos where they listen. But I've got them where they don't. And so there are times where I'll have to stop working with that little girl and just focus on the one who won't leave and do a whole piece of work with it. It might take us in a whole different tangent and then ultimately come back. Just like you saw at the end, I came back to the little girl who thought she killed her mother. That one's probably going to need another session because we didn't have time to really get into that. But you kind of bookmark it and you say, I'm going to be sure to come back here, but right now we got to do this. But the point being, it's sort of Taoist in the sense that you're going with the flow. If you get stuck, you don't fight the one who's stuck. It becomes the new target part. And you work with it, and then you go to the next one. Yeah.
I think the other thing you have not mentioned is your presence.
Yeah, so what do you want to say about my presence?
I want to say that your presence is grounded enough or present enough or still enough that when they come in, you're just...
Here's the next one. Right. Yeah, so I am, you could see all those C words in my presence, and lack of judgment, total acceptance of whatever's coming, and calm, and it's sort of like one of the things I love about the GPS is you can get totally way off course, and it says, now you're here, now you go here. It doesn't say, what the hell were you doing? How did you get over it? Yeah.
To what extent is the flow that you want to work with and the group interfered with by the clock?
Yeah, so...
How much do you have to look at the clock and say, I can't go there now, I have to do something?
Another good question. So you might have noticed I looked at the clock a couple times. That's what I was looking at. Yeah, I was looking at the clock, and in my office I look at my watch, do I have time to do the next piece? You know, we've got to the exile, we have this trusting relationship that's happened. Do I really have time to do the witnessing?
A
No.
lot of places that are hard to, that you work very hard to get
Yes.
to, and it would seem like it might be a challenge to get back there.
That's right. And when that's the case, when I really think it's going to be really hard to get back, I'll run over. I'll just do what it takes till we do the unburdening. But if I don't feel like that, like there's a lot of clients I have where, you know, we got 10 minutes left. Do I really have time to do the witnessing? Probably not. We're going to freeze it right here. We're going to pick it up here next week. And they can, and we do. So there are these stages, and you just kind of can freeze it between any of these stages.
Do you actually use that term?
Freeze it here? Yeah. Yeah, absolutely. Yeah. Why do I ask, can you find it in or around your body? That's just because some people find them around their body. Before we jump to the couples thing, and because this kind of came up at lunch, I was going to show a video from, how many of you have heard of the research that's being done with MDMA and PTSD? Okay. So they're going into phase 3 trials. It's very impressive. It's comparable results to the results we got with PTSD. And it seems that the medicine, the MDMA, has the effect of helping people access a huge amount of self very quickly. And it turns out that when people do access a huge amount of self quickly, most of them begin to work with their parts in the way that you just saw. That most people spontaneously, without any cueing from the therapist, begin to do this work. And when I first saw these videos, it was so confirming because it just showed that I stumbled onto something that everybody knows how to do. That's just natural, inherent in us to do this. So the guy that spearheads the whole thing is named Michael Mithoefer, and he's an IFS therapist, well-trained, totally into IFS. And what he found was almost 80% of these people, up till now, spontaneously start to work with their parts without any cueing from him. And we don't seem to need it, so because we can access self in other ways. So use that as a segue to shift into couples. So when we work with couples, like I said earlier, most of the time they come in and it's parts wars. There's no self to be found. And it's just these protectors, looping and escalating each other. And so part of the hard work in the beginning is to achieve that U-turn in focus, such that each partner starts to listen inside themselves rather than keeping their eye on the other person as the person who needs to change. And then as they do that, we get to know their parts, and there are ways to kind of track the sequences between them in their fights, which I learned to do in family therapy. So when you do this, what do you do? And when you do that, what happens then? And just find the whole vicious circle of it. But you can add a loop to that tracking. So when she does this, what happens inside of you? Oh, it triggers this part and this part and this part, is that right? Okay, and which of those then takes over? This one, okay. And when that part of you takes over, what do you do or say? And then to the other partner, when he says that, what happens inside of you? And so we're kind of bringing to the surface the parts on both sides that are so triggered by these interactions. And then at some point asking if each of them will commit to work with their side of it, with their parts. And also perhaps negotiating whether or not they'd be willing to do that in the presence of the other or not, how safe that feels. And I'll make that call, because a lot of times one partner is afraid to say they don't want the other to be there. So if I don't feel like it's safe, I'm going to say, you need to step out while we do this work. So that's one side of the work with couples, is again, just achieving the U-turn, getting the parts that get triggered by each side on the table, and have them contract to start doing this kind of work, and then do a session like you saw with Annie, either with the partner there or not. The other side of the work is really trying to help each partner deal with their issues with the other while they're in self, speaking for their parts rather than from their parts. So this concept that, because most of the time we're speaking from our parts, basically. So as I'm having people interact with each other, I ask permission to be the parts detector. And as they interact, I'll say, time out. Okay, I want you both to focus inside and find the parts that have been doing the talking, and don't come back until you can speak for them rather than from them. And by that I mean speak with an open heart about the part and what it's saying. And often, don't just speak for the protector. See if you can find out what it's protecting and come back and speak for that exile to your partner. So, a client might say, Risa, I hate when you say that. I'd say, stop, find that part. A few minutes I'd come back, I said, yeah, okay, there's a part of me that gets really angry, gets very triggered when you say that, and I notice it's protecting this little boy in there who feels very shamed, and that's why it came out so. So it's a totally different message, right? That I hate when you do that. So you get the idea? So just that, if you take nothing else away from this workshop, just that idea of holding people in self, speaking for their parts, will take you a long way. Because, as I said this morning, self heals. So if you just get enough self in the room, something good's going to happen, one way or another. Any questions about that? Speaking for other from, it's useful in groups, in corporate kind of stuff. We're training conflict resolution people, international conflict resolution people, mediators, and this one is really, really valuable at all those levels. Yeah.
So with a couple that is open-hearted, that wants to do the work, and obviously each of them have various parts that they have to connect with. Typically, how many sessions, I mean, if there is a typically, how many sessions does it take, an hour-long session, to do you separate the work? Do you separate the couple, or
Yeah, so depends on the volatility of the couple. So I'll say to people, I don't let you hurt each other in my presence. So if you can't control these parts of you, I'm going to have you leave, and I'm going to talk to each of you separately for a period of time. We're just going to do parallel sessions. Now, I know there are some couples therapists that won't do that feel like it's confidential or a secrecy issue, and you don't want to hold secrets the other doesn't know, and blah, blah, blah. Because we're having self do the healing, and because of this U-turn idea, I'm not sitting with couples where they're bad-mouthing their partner very often. I'm mainly sitting with them individually, helping them do work on themselves. And the other one trusts that, so they're not going to worry that I'm getting all these secrets that they don't know about. So, but I will do that. If it comes to that, I'm going to just see them separately for a while until there's a little more self and they can be together. If you ask the partner to leave the room, how does it affect their protectors? And some people don't like it, but they know they're going to get a turn, so it's not like I'm just going to listen to this partner and not the other. Which is the same with these everything is parallel. Everything that happens in here happens out here, and vice versa. So if you're working with a polarization and you start to head toward one part, the other is going to rush in and say, but you got to hear my side of it. So you got to tell them, okay, we will, but one at a time, and we're going to start here. And you stay out until we're done. So it's pretty much the same. So, yeah.
Can you elaborate on the polarization? You just mentioned that.
Polarization idea?
Yeah.
Yeah, so in internal systems, whenever one part gets extreme in one direction, there's going to be a part getting extreme in the opposite direction to counter it. It's called polarization. And then they battle with each other, often protecting the same exile. So if you're a family therapist and you've done work with a family that has a very, very vulnerable child, you'll often find a polarization between the parents about how best to raise that child. So the one parent is the hard ass and the other one to counter that, because the other parent thinks it's too hard, it gets too soft. And then the other one has to get harder because without, you know what I'm saying? The same thing happens with this inner system. Does that help? Yeah. Yeah. I mean, there is part of the fear that a lot of people have about being directive is they'll have to rely on a part rather than do it from self, because as we've been talking, there's a conception that self isn't going to be very active or effective in the world, and it turns out you can be very forceful with an open heart, and people will hear it, whereas if you do it from a part, they get defensive. So there's this idea we have of a kind of compassionate confrontation, for example. The question is, how do you close a session? Maybe if his husband had been there, what do you need to do to be sure it doesn't create chaos at home and so on? How do you help them follow up? So that's a good question, and it can be dicey because being that vulnerable in front of your partner, who your parts have protected you from for a long time, is going to put other parts of you on a kind of hair trigger when you go home. And so even if the husband, in this case, did a good job of being in self and being, there's still going to be this edginess in their relationship. So a lot of times, after something like that, I'll say, here's your homework. Just stay the hell away from each other till our next session. Because it's not safe for you guys to interact right now. So, or I'll say, and if you do wind up, just know you're in for a rough week. It could well be a very rough week because you were so vulnerable in front of the other. And that's so scary. And so I'll do a lot of that kind of predicting, and yeah. And again, that's a critique I have of some couples therapies where you try to get people to be that intimate and think that they should be fine now, you know, and it's really the opposite. You drop your weapons that much, and you have protectors that are going to nail the person as soon as they look at you the wrong way. So I'm trying to anticipate that kind of stuff all the time. Yeah.
Do they get, as they do more of it, do they get safer with each other?
Yeah, yeah.
More self and more, yeah.
Yeah, very much. It's the same with the first time you get an exile out of exile with a client. It's sort of like the first pickle out of the pickle jar. And the first one is really hard, and then the ones after that are a lot easier. So
I haven't used that one before.
you got to think. It takes a while to really get that one. Yeah.
So I have a part that's kind of nervous in saying this, but in respect to the directive approach, when I have done my personal work, I have a part that wants to take control. I appreciate, and I would say to anybody here, when a person does take that position with me, because my protectors jump in, myself is lost. When it's 5 minutes before that hour, and I've just paid my $200, and I walk out having spoken the whole session about my story, and haven't had a chance to get to my stuff, I have regrets.
Yeah.
And it's extremely expensive.
Yeah.
And I believe that the professional has a responsibility. And I've gone through talk therapy for many, many years, and I won't go back to it because I haven't got results with IFS. In 5 months, I've changed 20 years.
What'd you say? Say that again.
Repeat the statement.
Repeat the statement.
I have a part full of pride with my connection, saying I'm a client. And I'm welcome here just like all my parts.
Absolutely.
So I told you earlier, thank you.
You're welcome.
But I want my money's worth too. I don't want to come out of there not feeling like I got to where I wanted to go because someone was generous and compassionate with me.
Yep. And there are parts that'll fill a session with talk. These narrating, thinking parts will just tell you the story. And they're doing it to stay away from the exile. And the frame I have for this, I said earlier, it's a bunch of little kids, even the big-time protectors. And they're just waiting for somebody to come along who seems grown up and knows what they're doing. And if you come in like that, and you say, trust me, just step out. Let me handle this. They welcome it. Even though they come jumping back in over and over because they're so scared. They're just dying for somebody to come in and be a little bit firm with them.
Do you have the courage to calmly and clearly make an intervention that says, you need to step aside? Because that also comes from a place of compassion. But for those of us that are more used to sort of settling back and curiosity and compassion, that's great. When you add that sea of courage, it makes for a more effective IFS therapist.
Right. Okay, do you have a little picture of how this might work with couples? Yeah. Okay. Yeah.
Are there some couples you wouldn't use this with?
Are there some couples I wouldn't use this with? I can't think of any off the top of my head. I mean, I might use it, like I said earlier, seeing one of them, each of them separately for a period of time. But yeah. I think I said this earlier, but I work with, I have a history of working with lots of criminals. Yeah, I spent 7 years consulting to a treatment center for sex offenders and spent a lot of time doing inner work with them. And you get to the part that offended, and it's got its story, and it's carrying their perpetrator's burden, and you get past that, and it's a bunch of little exiles. And you heal them, and then this one gives up its thing. So one of my visions is that prisons become healing places, you know? Because they can't control it, like you were saying. They might need to be in prison, but while they're in prison, why punish them and why not, which makes those parts that much stronger, and why not help them heal? And there are groups doing that with IFS now, but it's just a tiny thing of what we could do. Yeah.
With couples and blended parts, can you speak a little bit about that?
How do you get couples unblended from their protectors, or?
Yeah, you know, or if maybe one of the partners is blended with something. And I guess it's also this where maybe a person is not really open to seeing themselves as having parts.
Yeah, I mean, that's, again, you might have to do an individual session with them to try and help them get there. And the other thing about that is there are a number of people who will fight you on, I don't have parts. But it's not about that. It's they don't trust you enough to go inside. And they'll fight any wording, any attempt to get them to look inside themselves. And that's actually much of the time when you get resistance like that. And if you wait a handful of sessions and you've built up more trust, and then you bring it up, oh yeah, I've got this one and that one. So, you know, some of that P-word patience is sometimes the remedy to that.
A little bit of a balance with being the directive.
Yeah, it's a challenge. You got to have a pretty good nose for when it's better not to be so directive and back off and build up more confidence. Yeah.
Back to that couple. So you've done work with the couple. One person, you've only had time to kind of process one person's parts. They've been super vulnerable, and then they go away, and they're kind of at risk for a bit of a shame spiral leaving there. So you tell them to kind of stay apart.
Right.
What do you do when they come back in again?
You check on how they're doing and what happened during the week, and if it went okay, then you try to get the other partner to work. And so I try to keep a kind of balance going that way. Yeah.
So that person being more vulnerable to the shame spiral, should that work kind of contain them that you just did? So that should be less likely, or do you find that happens anyway?
It might happen, that's the backlash, is the shame spiral, and it might happen anyway. So if it did happen, then I'm going to work with that first, and then, yeah. Yeah.
Would you do this kind of parts work with a couple where there'd been some domestic abuse?
You know, I might do it with them very separate for a while. So that thing I was talking about earlier with the exiles being so desperate for redemption and picking somebody who resembled their parent, remember all that? Is really common in domestic abuse. And that's why you get the victim, quote unquote, returning over and over despite the fact that it makes no sense logically, because their exile is still attached to that redeemer when he is nice to them and has that hope of redemption. And until you actually heal that, it's really hard for that person to move on and to not keep going back. So that's just one example of what we do with domestic abuse. Okay, yeah.
So saying sometimes sexuality creates an impasse in couple therapy because someone is just dead set, well, I can, you know, share a bed with this, but I'm not having sex with them, and parts of them are attracted to people outside the marriage. It comes up more often when we look for it. I think, and I was just asking Richard if in IFS you can work with that by finding clusters of parts and maybe a shame exile or different polarizations.
Very much. In fact, I think I'll go ahead and show this video because it's a gay couple who sexuality is the issue. And you'll see some of what you just talked about, I think. Yeah, have I witnessed that having unburdened lots of parts, do people still have differences in temperament and what they like in terms of intimacy? Of course. But it's much, much easier to negotiate that when it's not based on these protectors doing the negotiation. So the standoff part, the part that set boundaries, was protecting the part that felt so much shame about being gay and felt like it had to just disappear and wanted to be alone and so on. And so that isn't so much the thing I was talking about earlier. Although, when you have that much shame, it's likely his sexual part is a firefighter that's reacting to that shame to get him away from it. So his need for a lot of sex may well be related to that. We didn't get to that far with the piece. So, did you follow that?
Yeah. Can you speak about the shame spiral, though?
Well, again, it's a three-part phenomena. So there's the exile who carries the shame. There's the critic who says you're a shit. The exile believes it. And then there's the firefighter who has to get you away from it. And he'll do it in some extreme way that then brings on more shame, both internal shame and shame from the outside world, that then goes right to the heart of that exile, adds more shame to it, and makes the job of the firefighter that much harder and more necessary, and so on. And most addiction programs, most eating disorder programs just contribute to that spiral. Because they give the message, you should be able to control this. You should be able to be dry. You shouldn't get off the wagon. You should, you know, when I'm working with somebody and you know, they're very proudly dry for a long time, and then they come in and they say, you know, I fell off the wagon last week. I feel so bad about that. I say, that's great. That's fantastic. Because now we have a direct line to some exile we haven't healed yet. This is a very different paradigm. Okay?
Well, this was such a profound experience for me. I was so anxious to learn all about IFS.
It has blown my mind to see what IFS can do with myself and with my clients, not just in my own practice, but in the practice that we did as a group.
It's a very comprehensive training, and it does more in my mind than just simply give someone an introduction to the model.
I was able to use the model on me in a very precise manner. And so these, I don't know, 3 months, I don't know, maybe 3 months that we were together were invaluable to me.
Right, and I learned so much professionally and also for my personal growth. It was great.
An additional benefit for me is just having access to the model through Derek's lens. I use this freely through an additional master, a master of IFS, which Derek Scott truly is. For me, has been really helpful, very beneficial, and has helped me to learn as I continue on with my journey.
I must say Derek is an excellent teacher.
I knew that I would be working with somebody who was that talented of a therapist and a teacher.
Derek led this group brilliantly and beautifully through amazing transformation.
There's nothing in the level 1 training that Derek didn't cover in this Stepping Stone course in some form or fashion, either in his direct teaching or through the manual or through some method. And so it's a very comprehensive training.
He gave us so much of theoretical knowledge about IFS model.
And finally, to have access to the comprehensive nature of this material presented through Derek in the comfort of your own home or office is truly amazing.
I feel really connected to not only Derek, but the community that we've created online in all different parts of the world.
I couldn't find it in my country, and a level 1 course was too far away. So this online course was really great for me.
You know, to be able to reach many parts of the world. And so it ignited something here in Brazil. And I think this is going to be for Brazil's own good, because we need IFS.
It has been a true joy and pleasure.
I'm grateful that I took this course, and I really recommend it to all that want to know more about it, but also to have a chance to experience in this role playing and doing the sessions.
I was a therapist, and I also was a client, and I was an observer. But through my experience in those roles, it had such a profound impact on me.
It has helped me to learn as I continue on with my journey.
I thank Derek very much for making this course, this stepping stone that's much more than just a stepping stone, available to all parts of the world.
All my parts are welcome. I felt that I'm supported all the time from Derek and everybody in this group.
IFS is a model I want to continue to learn, and Derek's a person I want to continue to learn with. So this has been really profound.
It was an incredible, challenging and fulfilling experience. So I'm super grateful that I got to be a part of this. Thanks, Derek.
I wanted to see you guys some more. I didn't want to really say goodbye.